I'm John Strum, and this is RealTalk MS. It's October 25th, and we have a lot to talk about. I arrived in Amsterdam today because this year's ECTRIMS Congress gets underway tomorrow. ECTRIMS is an acronym for the European Committee for Treatment and Research in Multiple Sclerosis, and this annual scientific congress is the largest MS research conference in the world. After 2 years of virtual meetings, this year's ECTRIMS Congress is a hybrid event. I'm looking forward to 3 very full days of presentations and conversations with some of the world's leading MS experts. And I'll be sharing all of that with you beginning with next week's episode of RealTalk MS. A couple of months ago, President Biden signed the Inflation Reduction Act into law. And at the time, I said that even though the law touched a number of different areas, it would be remembered as the largest and most consequential health care bill since the Affordable Care Act. In the weeks since we first talked about the Inflation Reduction Act, I've read all your emails, and most of you asked one form or another of the same question. How will this impact what I pay for my MS medications, and when will I see that benefit? Today, I'm joined by the National MS Society's Vice President of Advocacy, Steffany Stern, and MS activist, Judy Wilson. And we're talking about how this new law benefits people living with MS, who among all the people living with MS will first see some of those benefits, and when you'll begin to see those benefits. But before we get to my conversation with Steffany Stern and Judy Wilson, there are a few other things that you should know about. Newly published research results out of Germany show that people with progressive forms of MS are nearly 4 times more likely to have serious infections that require hospitalization than are people living with relapsing-remitting MS. In this study, the research team analyzed administrative health claims data from 4,250 adults living with MS in Germany from 2016 to 2018. 54.3% of these individuals had relapsing-remitting MS, 13.1% had secondary progressive MS, 6.6% had primary progressive MS, and the MS subtype wasn't specified in the records of 26.7% of the individuals in the study group. All 3 of these groups were comprised mainly of women. The median age of the people with relapsing-remitting MS was 47, and the median age of the people with progressive forms of MS was 63. Just over 82% of the people with relapsing-remitting MS were on a disease-modifying medication, while 31% of the people with secondary progressive MS were on a disease-modifying medication, and about 24% of the people with primary progressive MS were on a disease-modifying medication. The entire group was followed for a median of 3.87 years, and during that time, 294 people in the study group passed away. The research team measured the incidence rates of serious infections, that is, infections that required hospitalization, and the results of the study showed that 14.5% of the study participants with primary progressive MS experienced serious infection, 10.4% of the study participants with secondary progressive MS experienced serious infection, and just 2.8% of the people with relapsing-remitting MS experienced serious infection. Men showed a nearly twice as high rate of serious infection compared to women, and increases in serious infection seem to correspond to increases in age. Future research in this area will hopefully look at variables like disability status and comorbidities as researchers continue to better understand who among people living with MS is most likely to find themselves admitted to the hospital to fight a serious infection. If you'd like to review the details of this study, you'll find a link in today's show notes. When we consider the various health-related apps that are available today, we often see apps that serve as repositories of the information that we manually provide. But next-generation apps may be capable of doing much more than simply collecting and storing the information we enter into them. A research team comprised of scientists from Carnegie Mellon University, the University of Pittsburgh, and the University of Washington collaborated on a study to determine whether data collected from other apps and from fitness trackers could be used to predict clinically relevant outcomes like worsening fatigue or depression among people living with MS. Study participants downloaded an app that automatically captured phone call activity, location data, and screen activity data from their smartphones. They were also given fitness trackers to track their steps, heart rate, and sleep. And they were asked to complete standardized patient-reported measures of depression, fatigue, sleep quality, and MS symptom severity. Finally, the research team created a machine learning algorithm that analyzed all of this digital data and predicted patient outcomes related to depression, fatigue, sleep quality, and MS symptom worsening. Now, as we've discussed in past podcast episodes, machine learning is a form of artificial intelligence. There were 56 study participants whose information was continuously collected from November 16, 2019 to May 15, 2020. And if you think back to those months, you can see that the first half of this study was conducted pre-pandemic, and the second half was conducted during the initial pandemic lockdown. This unplanned scenario gave the research team a unique opportunity to determine whether they could successfully leverage artificial intelligence to predict patient outcomes when in-person health visits had pretty much stopped. The results of the study showed that by analyzing data on phone calls, heart rate, and location, the computer had 82.5% accuracy in predicting the occurrence of depression during those stay-at-home months. The computer used the same data to predict severe fatigue versus mild fatigue with 75.5% accuracy. The computer was also able to predict better sleep quality versus poor sleep quality with 84% accuracy, and it could also predict a high MS symptom burden on an individual with 90% accuracy. Now, this study is interesting for a few different reasons. For one, it demonstrates the validity of analyzing passively sensed behavior changes to predict health outcomes. Imagine for a moment that you've downloaded this kind of app onto your smartphone, and over the days and weeks, that machine learning algorithm is somewhere behind the scenes, analyzing activities like screen activity, location data, or phone call activity, and based upon this passive data collection, the algorithm shows with a high degree of accuracy that you're heading for depression. So the computer shoots an email to your MS care team, and they reach out to you, inviting you to come in for an assessment. It's artificial intelligence enabling your care team to practice proactive medicine and deliver an intervention before life starts to feel overwhelming to you. Now, the scenario I just described isn't yet possible, but it's not far off in the future either. And it's studies like this initial small study that provide the evidence, the building blocks that will usher in the kinds of clinical advancements that we've never seen before. If you'd like to review the details of this study, you'll find a link in today's show notes. It's hard to read or watch the news today without hearing about the impact of inflation on consumer spending. Whether it's an increase in the price of groceries or gasoline, inflation makes it more challenging than ever for families to make financial ends meet. And if someone in that family is living with a chronic illness like MS, those challenges can become even more daunting. The MS Society in the UK surveyed just over 1,100 people living with MS And almost 20% of the survey respondents said that they were worried that they wouldn't have enough money to pay for their disease-modifying medications. A third of the survey respondents said that they could no longer afford to eat balanced meals. And 40% said that they were already borrowing money to make ends meet. This unfortunate situation is not limited to the United Kingdom. Here in the U.S., where the price of prescription medications was already sky high before inflation struck, things are not any better. Living with MS is challenging, and that's when we're all living through the normal ups and downs of life. But you can't call it normal when choosing to buy fresh fruits and vegetables might mean having to quit the gym or cancel those sessions at the yoga studio. Those visits to the gym or yoga studio have been shown to improve the well-being of people living with MS. And you can't call it normal when filling your car with gas so that you can get to and from work means that your prescription medications may be financially out of reach. Inflation affects most families, but it's easy to see how it can affect families living with a chronic illness like MS the most. That's why the recent passing of the Inflation Reduction Act in the United States was so important. This new law carries real benefits for many people who are living with MS. It also represents a first step toward tackling the high price of prescription medications, a step forward in a conversation that no one has really wanted to have for the past several decades. This is something that the National MS Society and MS activists across the country have worked incredibly hard to help bring about. Joining me to talk about how and when the Inflation Reduction Act will impact the amount of money you spend on your prescription medications every year is the National MS Society's Vice President of Advocacy, Steffany Stern, and MS activist, Judy Wilson. In a moment, we'll meet Steffany and Judy. Over the past 29 years, disease-modifying medications have transformed MS treatment. But for some people living with MS, these medications are increasingly out of reach because they're simply unaffordable. According to a National MS Society survey conducted in 2019, more than half the survey respondents said they were concerned about being able to afford their disease-modifying medications, and 40% indicated that they had stopped, skipped, or delayed treatment with disease-modifying medications due to their high cost. That's why the recent passage of the Inflation Reduction Act is welcome news. It's the very first legislative step toward making prescription medications affordable. Joining me to talk about how this new law will impact people living with MS are the Vice President of Advocacy for the National MS Society, Steffany Stern, and MS activist, Judy Wilson. Steffany, Judy, welcome to the podcast.
Thanks for having us.
Steffany, maybe you can provide some context to our conversation. Can you tell us how the market has changed since disease-modifying medications first became available?
Yes, happy to talk that through. I think the big takeaway is that the price of the MS disease-modifying therapies has been going up dramatically since the first MS drug came to market in 1993. That first medication that came on market was priced at that time at $8,000 to $11,000 for a year. Compared to, as of this year in February of 2022, the median annual price of the brand name MS disease modifying therapies was almost $94,000. And the prices for all of these medications has gone up. So 6 of the MS drugs we've been tracking have increased in price or over 200% since they came on market. 9 of them are now at over $100,000 a year. So you can tell right off the bat, these types of prices and that kind of increases, people with MS cannot keep going with the situation. And these are not the only drugs that people with MS are taking. They're taking other symptom management medications or other medications for other health conditions that they might have. So I do think it's very important to point out these medications have been absolutely transformational for people with MS. Not everyone, but for the people with MS who are able to take them. My mom was diagnosed in 1981, and at that time there was nothing for her. There were no treatments, and now we have over 20 drugs to treat MS. But for these medications to make a difference in people's lives, they have to be affordable.
So, Steffany, let me ask you, how has this dramatic escalation in prices, how's it affected people who are living with MS?
Yes. So I think, people have seen the price increases affect what they're paying out of their pocket, and they have seen it affect the process they have to go through to get their drugs. As these prices have increased, we have seen the insurance companies, the health plans, and the pharmacy benefit managers put forward more and more hurdles and hoops for people to jump through when they have to when they're trying to access their drugs. So, your listeners, I'm sure, are very familiar with the tools like having to get prior authorization for their medication, going through step therapy. They've seen more and more restrictive formularies. And those things can be very difficult to navigate for a person's doctor or for the person with MS. And a lot of times people are seeing delays in their treatment, or some people have gone off treatment because it's been so difficult to get through the process. And again, the people with MS have been paying increasing amounts of money out of their own pocket for their medications. Because as a result of these drug prices going up, the insurers have been passing more costs along to the person with MS and the patient.
Judy, how long have you been living with MS?
I was diagnosed in 2010, so it's been 12 years since I've been diagnosed.
And how has the price of disease-modifying medications affected you and your treatment?
Wow, it's been, over the years, it's escalated. It started out at $32,000 a year, and it ended up a year ago at $72,000 a year. So it's been huge. And what's happened is that since I got on Medicare, I was able to, prior to that, I was able to get charitable foundations to help me out with the copays, which were $7,000 just for those medications. And I was unable to get that assistance. And so therefore, I discontinued taking my medications. Well,
I'm so sorry to hear that. How has stopping treatment affected you?
Well, it's basically, it's a risk that I'm taking. I could end up with mobility and cognitive issues. There's no guarantee of what the situation will how it will affect me, but it was a decision based on money, not medicine. So there were, I had two other people in my MS group who discontinued taking their medications, and one of them ended up in the hospital. So it's all just a guessing game, I guess.
Given this very high stakes guessing game, that sounds like a heavy burden to carry with you. Is it something that is on your mind a lot?
Yes, because I just, MS is not a predictable disease in any case. There's so many symptoms that I've had to deal with, and one can pop up, one could get worse. You just don't know. You don't know from day to day exactly how MS is going to affect you.
Well, we can multiply Judy's story by the hundreds of thousands of people who are on Medicare living with MS. That's hundreds of thousands of families faced with this untenable option of altering or even stopping treatment or looking at financial disaster. That's why the provisions of the Inflation Reduction Act are so vitally important. Steffany, can you tell us about the new law and the role that the National MS Society played in making it a reality?
Yes, I am happy to talk through the provisions of the new law. We are very, very excited about the Inflation Reduction Act and the potential it holds for bringing down costs for people living with MS. And I do think it's important to point out, people with MS did play a key role in getting this legislation across the finish line. People like Judy have been sharing their stories with legislators and their staff and, talking to the press and doing social media, having meetings, making noise and making it clear that in this country, people on Medicare should not have to, face extreme financial hardship or when they're on Medicare to afford their drugs. And people shouldn't be faced with the decision to go off of their very important medication when they have health coverage in the form of Medicare. So we, the MS activism movement, help provide momentum to get this law passed. And that is just a wonderful thing to be a part of. And I'm so glad to be talking through what this means. So I'll talk about the out-of-pocket pieces first, John, and then we can maybe take a break and if you have any additional questions. So the centerpiece of this law, when it comes to the society's core priorities for what we wanted Congress to address for Medicare, is an out-of-pocket cap for what people pay for their medications when they're on Medicare. Right now, there's no cap on what people on Medicare spend on their medications, and that's been a big problem with Medicare drug coverage since for many years. So as a result of not having this cap, people with health conditions are paying a ton of money out of their own pocket. And there's no predictability in a given year on what you're going to end up paying. And we have data that tells us that out-of-pocket spending for people with MS who are on Medicare just for their MS disease-modifying therapy is almost $7,000 per year. That's a lot of money. But all that is about to change because people on Medicare, under this new law, they will now pay soon no more than $2,000 per year for all of their drugs cumulatively. And that represents thousands of dollars in savings on average for people with MS. And perhaps equally as exciting about this new law is that that people will be able to spread that $2,000 evenly throughout the year. So they won't have all those costs right up front in, right at the beginning of the year, January through March or April. People are typically very overwhelmed paying for their medications. In the future, under this law, you'll be able to divide up what you owe equally and pay it in smaller amounts and have that predictability on what you're going to spend in a year and when you're going to spend it that you just do not have now. And we know this is what people with MS have been asking for, an out-of-pocket cap. And this, they call it a smoothing mechanism where your costs are spread throughout the year. We know this is going to be, a fundamental change for people who rely on Medicare to get their medications. I do want people to be cognizant of the fact that the out-of-pocket cap doesn't go into effect immediately. It will be implemented in January of 2025. So we're preparing for that to go into effect. We're also going to see reforms for people with very high costs for their drugs end up in what they call the catastrophic coverage phase, and they have to pay a share of the cost of their medications in that coverage phase. And on average, people are paying about $350 per month out of pocket for their drugs, even once they get to the catastrophic phase, which is a lot of money for people on a fixed income, or really for anyone. $350 is a lot of money per month for your drugs. In January of 2024, people will on Medicare Part D are no longer going to have to pay 5% coinsurance when they're in the catastrophic coverage phase. So that's one piece that goes into effect a little bit sooner. So those are the two core pieces that reform what people are paying out of their pocket for their drugs.
Judy, what does seeing this new law passed mean to you?
Well, it means that there's an opportunity to continue using my disease-modifying drug. I think that the financial stress will be relieved to some degree, particularly since the payments can be spread over the entire year.
We know that prescription drug price reform has to go further than limiting out-of-pocket costs. It has to lower the price of the medications themselves. So, Steffany, can you explain what inflationary rebates are, how they work, and when they go into effect?
Yes, I'm happy to explain it. And I will say I identify as a policy wonk, but this is a very wonky provision and kind of technical. So I'm going to try to explain it in simple terms, but you feel free to, stop me at any point if you want me to break it down. But essentially, I would say the goal of this provision, the inflationary rebates, is to make it so that drug companies are discouraged from raising the prices of their drugs for Medicare faster than inflation. So if a drug company does raise prices faster than inflation, they will have to pay a rebate back to the government for that above inflation amount of that price increase, starting very soon. And we know the government's already doing this in other healthcare programs for Medicaid, for example. So they have experience implementing this kind of rebate. Basically, this is not going to reduce the prices of drugs already on the market, but it will slow down or stop prices from increasing as fast and as massively as they have been increasing in recent years. And we know inflation is high right now, but we hope inflation goes down, and typically it's much lower than it is right now. And at any rate, this provision will have the effect of slowing those massive price increases we've seen for the MS disease modifying therapies. And this part goes into effect right away in October for Medicare Part D drugs. And then in January, the Medicare Part B drugs, those infusion and other doctor-administered medications, are also going to be covered, affected by this inflationary rebate policy.
Thanks to this new law, Medicare will be able to negotiate the price of prescription drugs for the very first time in history. Steffany, what does that mean, and what kind of an impact will it have?
Yes, I think this is the big headline news that a lot of people have been talking about. The Inflation Reduction Act creates a new drug price negotiation program within the Department of Health and Human Services, basically. And that means that the government can negotiate the price of certain expensive drugs within the Medicare program. So what does that mean? It means they can bring down the price of some medications. This is similar to what's already happening for private health insurance companies, what they're doing already, and what other types of government insurance the other insurers are already doing to bring down costs. Under this program, not every single drug would be eligible for negotiation. It's set up so that in the first year that it's operating, which is 2026, the agency will negotiate 10 drugs, and then after that, it rises to another 15, and another 15 the year after that, and another 20. But the government will be able to negotiate prices for some of these very costly medications. Drugs are not going to be immediately eligible for negotiation when they come on the market. They'll be subject to it after several years. So drug companies will still be able to recover the cost that they put into bringing the drug to market. So why does this matter? It matters because depending on how this plays out and how we think it'll play out, MS medications could be eligible for negotiation, and then their costs will go down. We don't really know yet, but we're anticipating this could affect some of the MS medications. And then as we keep moving down in the future, the government will be negotiating some of these big, blockbuster medications that we've all heard about in the news for other health conditions that have been on the market for years. And then that will allow them to move through and look at other medications like our medications. It also matters because so often people with MS are paying, they don't just pay like a, $50 copay. They're paying a share or a percentage of the cost of the medication, the co-insurance. And so that means that the actual price of the medication does have a direct link to what people are paying out of their pocket, and it has an effect on their, day-to-day lives.
If we look back at very recent history, some of us might recall the enhanced subsidies that were first adopted under the American Rescue Plan Act, a bill known to many people as the COVID Relief Bill. Now, these enhanced subsidies helped a lot of people buy their health insurance in the marketplaces or exchanges for far less than they had paid before. Were those subsidies included in this new law?
Yes, they were. And I'm so glad we're talking about this. There hasn't been a lot of news coverage about this piece of the Inflation Reduction Act, but it is so important. And it is another one of the priorities that our MS activists have been advocating for. The extension of these enhanced subsidies that help people buy coverage in the marketplaces or the exchanges for much cheaper than it was before. So people for the last couple of years have been able to go into the marketplaces and find coverage that has been reduced in price the last few years, and it's made a difference. There's now a record high number of people who are enrolled in marketplace coverage, and nationally, the uninsured rate is at a record low. So these subsidies were scheduled to be to end at the end of this year, unless Congress extended them, and Congress extended them in the Inflation Reduction Act. So they're now going to be extended through 2025, an additional 3 years. We're really excited about that because this kind of coverage is really helpful for people with MS who find themselves, falling into the coverage gap for any reason. And I do think I like calling out for people who are waiting through the Social Security disability process, they can buy coverage in the exchanges for very low price right now. So we're very happy to see that extended.
As we mentioned, the Inflation Reduction Act became law thanks in part to the advocacy work of the National MS Society and MS activists. Judy, I understand that you have a year of MS advocacy under your belt now. Can you tell me about your experience as an MS activist?
Yes, it's really been fantastic. It's been really fruitful to me. It feels that like I've made some contribution to the MS Society and the MS community. I was invited to a Senate hearing regarding the Inflation Reduction Act, and to be able to tell my story, it was really a fantastic opportunity. And then we actually had a celebration after the Inflation Reduction Act was signed, which was even more exciting because we felt like our fruits of our labor were actually being recognized. I've been speaking to senators and representatives in this last couple of months, talking in terms of asking for funding for research for the MS Society and for scientists and medical professionals to come up with new solutions for our MS community. And it's definitely something that I recommend that anybody who's interested in contributing to the success of the MS community as far as research and medical costs, definitely you should get involved in the activist program.
Well, as most of my listeners have heard before, I'm an MS activist. I have explained that, in my opinion, choosing to advocate on behalf of your own interests is one of the most empowering things that I think anyone can do. And if you happen to be a new listener and you haven't heard me say this before, you can learn more about how you can be a part of the movement as an MS activist by visiting nationalmssociety.org/advocacy. And I'll be sure to include that link in today's show notes. Steffany Stern, Judy Wilson, thank you for all you each do to improve the lives of people affected by MS. And thanks for talking with me today.
Thanks. It was great to be with you, John.
Thank you for this opportunity.
That's going to wrap up this episode of Real Talk MS. Real Talk MS is powered by the National MS Society. And you can share this episode of the podcast by letting your friends or family members know that all they have to do is point their web browser at realtalkms.com/269. You'll find that link in today's show notes, so you can easily copy and paste it right into an email or text. And if you have a minute, I hope you'll visit the Apple App Store or the Google Play Store and download the free RealTalk MS app for your iOS or Android smartphone or tablet. It's the best way for us to stay connected. The app will automatically download the latest episode of Real Talk MS. You'll be able to access any of our past episodes. You'll be able to save your favorite episodes. And it's a great way for me to share bonus content with you. The app is free, so I hope you'll download it today. I'm John Strum. Thanks for listening. Stay safe and make healthy choices.